Hello friends, you are welcome to another exciting episode of Youth Empowerment Series. My name is Lady Dr. Sheila and this community is called Health Gist How. Yes, Health Gist How. We gist about everything and anything that has got to do with our health, especially things that affect the health of our youth. We discuss topics that impact on our youth positively. We discuss topics that will make our youth better adults when they grow up. So we discuss relevant topics that concern our youth in terms of their health. We discuss mental health. We discuss reproductive health. We discuss relationship choices. We discuss education. We discuss family. We even discuss economic empowerment, because we want our youth to be all-rounded and well-grounded and resilient even as they transit into their adult life. So if you are interested in topics like this, then you are at the right place. You are welcome. Come right in and take a seat. We are happy to have you with us. So since you like what we discuss here, I would encourage you to subscribe to this channel, give it a thumbs up, and also share it with all your contacts so that they will also benefit from what we discuss here. Do that before you forget, because by the time you finish watching this video, you might forget and not subscribe or like it. So do that right away before we continue. Thank you. So the topic for our discussion this afternoon is causes and risk factors of cervical cancer. Yes, causes and risk factors of cervical cancer. Let me remind you that January is a month that has been slated by WHO for us to educate the public on cervical cancer. Just as we did for breast cancer in October, in the same vein, the WHO has slated January for us to use to educate the public on all that they need to know about cervical cancer. This is because cervical cancer is the second most common cancer among women in Africa. Most prevalent cancer among women worldwide is breast cancer. In the developed world is different. In the developed world, cervical cancer is not the second most prevalent cancer among women. It's lung cancer and even followed by colorectal cancer. But when it comes to Africa, cervical cancer is the second most prevalent cancer among women. So we need to take it serious and educate the public about it and let women know how they can protect themselves from cervical cancer, because it is possible for us to protect ourselves from cervical cancer. So let's look at what cervical cancer is. Cervical cancer, as the name goes, simply means cancer of the cervix. Cervical cancer means cancer of the cervix. And what is the cervix? What part of the body is called the cervix? So the cervix is the entrance of the uterus. I hope we all know what the uterus is. The uterus is also called the womb. The uterus is that organ that carries the baby when women get pregnant. So the entrance of that organ, the entrance of the uterus or the womb, is where we call, or is what we call the cervix. And this part of the womb or the cervix protrudes downwards into the vagina. So during childbirth, when the baby is descending from the uterus, so this is the outside world, the baby would usually go through the cervix and then through the vagina, and hooray, the baby is here with us in the outside world. So we all know that during labor, or we are all familiar with the term dilation. During labor, they will say, oh, the woman has dilated 2 centimeters, the woman has dilated 10 centimeters, she has dilated 5 centimeters. So this When they talk of dilation of the cervix, it is that part of the entrance or opening of the womb that opens in order to allow the baby to come out to the outside world for us to have our babies. That is a part of the body called the cervix. I believe we all now have an idea what the cervix is. So now let's look at the causes of cervical cancer. Over 99% of cervical cancer is caused by a virus called the human papilloma virus. Usually we'll shorten it and call it the HPV, human papilloma virus. It is a virus that is sexually transmitted and causes about 99% of cervical cancer in Africa. This value is with us here in Africa. It's not worldwide. The 99% of cervical cancer that is caused by this virus is for us Africans. It's with us Africans. It doesn't apply to the developed or the Western world. It's for us here in Africa. And this virus is sexually transmitted. So high-risk sexual behaviors like having multiple sexual partners, having indiscriminate sexual activities, or even our young ladies initiating sexual activities early in life can put them at risk of contracting this human papilloma virus and it staying in their body and causing changes in the cervix and later in life that can lead to cervical cancer if it is not picked up and treated before it gets to that stage. So it is important for us to advise our young girls, our youth, to defer sexual activities. Also the boys, because it is usually and most of the time it is both ways, isn't it? Let's try and defer sexual activities to later life so that the young people can protect themselves from contracting the human papilloma virus so that they can stay safe and then grow up to be the responsible adults you want to be. I hope you agree with me. So it's one of the sexually transmitted viruses, and we know a number of sexually transmitted viruses. We know of HIV, we know of hepatitis B. Those are the common ones we know. But now we are hearing today that the human papilloma virus is one virus that is sexually transmitted, and it also causes cervical cancer in our women. So it pays to defer the sexual activities to later life. It pays to wait. So let's try and work with that. Great. And because this virus causes 99% of cervical cancer, it makes it the most important risk factor in cervical cancer. There are other risk factors, but just imagine that we're saying that the human papilloma virus alone causes 99% of cervical cancer. So we say it is the most important risk factor in cervical cancer disease. There are other risk factors, and this includes smoking. And here we are talking about tobacco use. Smoking tobacco. So women who smoke tobacco should desist from smoking if you want to prevent yourself from getting cervical cancer. We all know smoking commonly causes lung cancer, right? That's what we know. Tobacco and lung cancer is the common disease we know. But now we are learning that smoking tobacco can also cause cervical cancer. Smoking tobacco has even been linked with breast cancer. You remember when we discussed breast cancer, we talked about smoking, and we said smoking put women at risk of developing breast cancer. It's the same thing. Smoking would also put women at risk of developing cervical cancer. And we are not talking about people who smoke all by themselves. Secondhand smoking also plays a role here. So if you are a lady who doesn't smoke but hang around people who smoke, your partner smokes, or you have friends who smoke, then you are at risk. You are at the same risk as the person who smokes. So secondhand smoking is not an excuse, and it doesn't exclude one from developing cervical cancer or breast cancer or even the lung cancer if you hang around people who smoke. So advise your friends not to smoke. And if you also smoke or you intend to smoke, please do not venture. Great. The next risk factor we want to talk about is obesity and overweight. Obesity and overweight have been linked with a number of health problems and cancers, and cervical cancer is one of them. We also remember that we said obesity and overweight also put women at risk of developing breast cancer. We discussed that in our breast cancer video. So just a recap from there. So we are also learning now that obesity and overweight can put women at risk of developing cervical cancer. So let's try and keep a healthy weight. Let's try and increase our physical activities. Let's try and eat healthy so that we can maintain healthy weight and protect ourselves from developing all these non-communicable diseases and cancers that are linked with overweight and obesity. The next risk factor we have to look at is advancing in age. Yes, advancing in age. And also even just being a woman or just being a female and carrying a uterus that comes with cervix put us at risk of developing cervical cancer. Advancing in age, there's nothing we can do about it. So advancing in age is similar to the non-modifiable risk factors we talked about in breast cancer. I hope you remember that. If you don't remember, please go and pull the breast cancer video and listen. So in breast cancer, we talked about modifiable and non-modifiable risk factors. Here, we are also talking about some non-modifiable risk factors like advancing in age and also being a woman and carrying a womb with cervix that put us at risk. There's nothing we can do about it. God is blessing us and we are going to grow age and grow old. So how do we protect ourselves? We can do this by doing our regular checkups, doing our regular scheduled pap smear. We'll be looking at prevention of cervical cancer. We are going to talk more about pap smear and how it prevents us from developing cervical cancer. So as we grow, there's nothing we can do about it. We are happy that God is blessing us and we are growing and we are going to grow old. But in order to live healthy, we have to do our regular checkups so that as we grow and as we age and as we are female, these factors that put us at risk will not be a problem for us once we do our regular checkups and ensure that anything that is developing will be picked up early and treated for us. In that case, we would be safe from all the health conditions that come with advancing in age. All too soon, we have come to the end of today's episode of Youth Empowerment Series. I believe you have enjoyed and learned something about today's episode. But we have a question of the day. We want this session, this period to be interactive. So at the end of every session, there will always be a question of the day. And we want you to be honest. Don't cheat. Be honest. We want these sessions to be interactive and also we learn at the same time. So the question of the day, I'll be pinning it at the comment sections. So go there and put your answer. So we want to know, before you watch this video, what was your impression about cervical cancer? Did you know of cervical cancer? Yes or no? We want to know if learning has taken place. Yes, if you knew of cervical cancer, did you know of some of the causes of cervical cancer? Let us know the causes you had in mind. We know when it comes to health and a health-related issue, there are a whole lot of myths and misconceptions surrounding health and health-related problems. Or as we go through this series, we want to know the myths and misconceptions people have in their mind, and then that will also help us know that we are impacting lives. To let us know that, okay, people had this myth and misconceptions, but at the end of it all, we were able to give out authentic and accurate health information. And as we discuss this authentic and accurate health information, try and throw away all the myths and misconceptions you have about certain disease conditions. We want to know what people had in mind, but at the same time we want to learn. And let me know whether this video is impactful. Let me know whether this video is useful. We are going to have 2 more videos on cervical cancer whilst we are still in January. Our next video will be on symptoms of cervical cancer, and that will be followed by preventions of cervical cancer. We are going to have all these 3 videos tackling all aspects of cervical cancer in this month, January. So don't go anywhere, and make sure you are sharing the video. Make sure you are giving a thumbs up to the video. Make sure you are subscribing to it and you are encouraging people to subscribe to. Thank you for staying with us. See you soon in our next video. Bye.